Judge Edwin Cameron has been on HIV treatment for almost 15 years. Cameron remains the only public official to have spoken out about his status. He says people now have a better understanding of HIV and AIDS, mainly because it's touched everyone.
Every single one of us in our country knows someone who has died of AIDS. We've had millions of AIDS deaths, and one of those deaths has affected each one of us. So that changes people's attitudes. They become less judgmental, they become less condemnatory, they become less ostracizing.
Edwin Cameron says the stigma long associated with HIV is declining for another much more beneficial reason. Treatment for the disease is now available.
People are now talking about their treatment. I think it's also helped that from World AIDS Day 2010 we had a mass public drive to get people tested for HIV. I think that's been beneficial. So many more people know their HIV status. Many more people know someone who's got an HIV positive status, and all of that has helped. Which doesn't mean to say that stigma has disappeared. It's still all too present, but it has diminished.
In December 1986, very little was known about the virus. Edwin Cameron was a young human rights lawyer, alone in his office, when his doctor phoned to tell him he was HIV positive.
I knew then what I know now. I would know that despite falling sick with AIDS, that I would recover and that I would lead a healthy, physically vigorous life. I wouldn't have felt so shattered, but one acquires that knowledge only with great pain and at the cost of very great experience.
When treatment eventually became available, medical insurance didn't cover it. Then Health Minister Dr. Nkosazana Dlamini-Zuma enacted legislation that made that unlawful. Despite such laws that prevent discrimination against people with HIV, Cameron has experienced his fair share.
It's like race discrimination or homophobia, people who don't like gays and lesbians. I'm a proudly gay man. It would be very difficult for someone to say to me, I don't like gay men. It's hard to say if people don't like you, whether they don't like you because you're too tall or too bald or too big or too outspoken or because you're too gay or because you're too HIV positive. It's always hard to say that. But I must say that once I've made my public statement about living with HIV, I got enormously positive reactions, enormous love and affirmation and acceptance, almost universally.
South Africa still has the highest number of people infected with HIV, but progress and advancements are being made every day. South Africa is now a world leader in treatment programs. Edwin Cameron is optimistic that we can stop this epidemic.
If we could find every last person today in our country, 5.6 or 5.7 million who had HIV, and reach them and say, start on treatment or stop doing any risk behaviors, we would stop this epidemic. So there's a lot more that we can do. We haven't reached everyone who's living with HIV, so we can test a lot more, we can treat a lot more.
I'm Tanja Bencun in Johannesburg.